Good afternoon. My name is Dr. Ngaga again. I want to take this chance to welcome you to the channel again. Today we're going to emphasize on symptoms of the COVID-19 infection. Now, this is a viral infection, as I mentioned earlier in my earlier videos. While in medicine we often look at the causes of infection and we often classify them into either bacteria, viruses, fungi, protozoa, among others. And as we speak, why we do this classification is really to help us, tailor the treatment towards the given cause, so that we don't really keep, treating blindly, because most of the time blind treatment really leads to failure of treatment. So that's why I think it's important that we know what it is that causing this given infection. Now, most viral infections are simply manageable without medication. We do what you call symptomatic treatment. Someone has a flu, they have running nose, you give an antihistamine to stop, the running nose. Someone has fever, you manage it with something for fever. That's the same thing with really COVID-19. So COVID-19 essentially affects the respiratory tract system. So respiratory tract system is also divided into upper and lower. Upper now includes the mouth, the nose, the throat, and actually the trachea. And of course now we talk of the lower, we talk of the lungs. So mostly COVID is actually affecting most the upper and lower system. So someone typically will present with a dry, chesty cough, chest pain, very high fevers ranging between 38 and 40 or even more. And most of the time not responding to the typical antipyretics like paracetamol. Yeah. And on that note, let's really avoid the use of diclofenac and ibuprofen, as some early research is done, especially in China, really pointed to the fact that use of the either diclofenac or ibuprofen, which we call non-steroidal anti-inflammatory drugs, could actually worsen the symptoms. So the other thing, of course, is a sore throat, a blocked, runny nose, and difficulty in breathing is also one of the things you could actually get, especially late in the stages. So that's why it's important that we be careful when we have such symptoms. I think the best thing to do when you have such symptoms is really to call the Ministry of Health through the toll-free line, that is 719. I've used it myself and it works. No matter when you call, it's actually something that directs you what to do, what to press, and then eventually there's even an option where you could speak to someone on the other line who's waiting for your question. So my thought is simple: you get these symptoms, stay home, observe yourself. But then when you having difficult breathing, you can't cope, you feel your fevers are not responding to paracetamol, then I think your best shot is actually to give a call to the Ministry of Health. Then the person on the other line can advise you on the way forward. Either they can advise you whether to come home for testing, or whether you're gonna call for an ambulance, or they're gonna come with an ambulance, take you to hospital, depending on how severe your symptoms are. I think that will really minimize the spread of the disease. It also minimize the chance of you really picking the disease, because what if you're just a common flu, cough, sneezing, running nose, fevers, and then you go to the hospital, you meet person B who has the infection. This is really gonna be you going with a common flu and then coming home with COVID-19, bringing it home to your family, to your parents, to your grandparents, some of whom may not really have a good immune system. So that's why we need to be careful. Please, let's continue practicing the social distance, hand washing, and now more recently we're talking about use of face mask, because it's also been shown that it actually really prevents spread. So if you have a mask, it will go a long way, preventing spread, you contracting the disease. So let's try and adhere to what we're being told, especially by the ministry. I think that would help us, really manage this disease. I think you've really seen already New York is overwhelmed. It's actually saying the healthcare system is collapsing. And remember, US has one of the best healthcare systems in the world. So I often try to imagine what could happen if we really get over 5,000 cases in the country. This could really overwhelm us. And our capacity is not as good as some countries, but I think we're gonna do our best. So mine is really to advise you to stay home and stay safe. Thank you.